Hello. Welcome to the fourth episode of my investment journey so far. Today is the 25th of January. It feels like the 90th of January, to be honest. It's been a very, very long month. So just to do a very quick update on what's happened since the last time that I posted. I think we're now on 26,456 pounds. I think that's roughly £3,000 up since the last time I did an update, which was about 2 weeks ago. And literally, all of this is based off of just one stock, which is Synairgen, which I will talk about a bit more in a few seconds. Just an update. I haven't deposited anything since the last time, not really. I think the last time I did a deposit was 24th of December, which is pretty much over a month ago. Like everyone else, it's been a very a long month over the Christmas period. Payday is at the end of this week, so most probably will be depositing some money and then looking for things to buy. It's just one of those where it's been such a long month, and Christmas spent a bit more on Christmas than I thought I would. I'm pretty sure a lot of people can relate to that. But yeah, so nothing added. The only difference, I think, I mentioned in the last episode that I was going to be selling some off of the N4 Pharma, but sort of decided against it because the opportunity hasn't come up with getting the right price for something else that I would want to buy. And at the meantime, there's a there's a news. I'm expecting some news in terms of N4 Pharma, and it's just a really good place, even though it's down by about 3%. I feel like it's just a really good place for me to park my money for now. Awaiting news. Chances are I'll probably trim this to about £1,000, so I will pull out about £2,000 when the price gets to a certain stage. I think I've sort of got my mind on at least 10p. At the moment, if it gets 10p, I'll take some money out of that. That also depends on Clinigen as well. I'm just being greedy. This at £7, 16p, it's really good price. But I would love for this to be on the £7. This is a company that I'm very bullish on. I really, really love what this company does, and I feel like they're going places, and I see myself holding this for 5 years. As far as being upfront and clear and precise on what they trying on the company, what a company is trying to do, they do that. I think over the past week, the only news that has come through is the fact that there's a new COO. I think a very capable person that I'm pretty sure will do a good job, and then there was the interim results as well, which isn't bad at all. Actually, it's quite good for what it is. In this time, in this sort of period that we're in, I think the reported 10% decrease in interim EBITDA, I think, compared to the same time last year. I mean, the fact that you can still make profit or you can still make money, or just get only 10% reduction in your earnings, in the UK, where there's been, I don't know, a lockdown for the past, I don't know, couple of months now, and they can't really, all the clinical trials have been suspended. So for them to just still be in it, it's really good, and that's a massive discount for pretty much just a 10% reduction in revenue. So yeah, I will be piling on this stock over the next few months. this will be going to about. I think I would like to build up to £20,000 worth of stock in this, and then hold it for 5 years. Also helps that they pay a little bit of dividend as well. But that's pretty much it with Clinigen. I love it. I will be buying into it heavy. N4 Pharma, again, doing really good things. A new VEC. It pretty much falls into the category of sort of what I'm looking for in terms of investment. The product, it's better than, it solves, you know, a very big problem that we currently have with vaccines, which is pretty much storage. With this, you can it's a better delivery system compared to everything else that is on the market at the moment. Does really good, better delivery system, highly scalable as well, and you can mass produce it and cheap to produce as well. So I'm waiting for news and then partnering up with somebody to develop that. So I just don't want to get too exposed to this for the time being. But depending on how the next few couple of months goes, this might stay or it might go. I have another company in mind that I'd like to add, but it's not currently on Freetrade. But hopefully it will come on soon enough. So let's go to Synairgen, which is my biggest holding. It's £20,600. I don't even want to calculate how big of a percentage of my portfolio this company is, but you know what? I'm comfortable with it. I've put in £12,000 so far into this, and it's brought me a profit of just over £8,500. I've only held it for 2 to 3 months. I think I started buying it at the end of October, so November, December, January. The only difference is I bought more since the last time. So I think the 7th of January was. I just looked around and I had some money in cash, and I was looking for somewhere to park the money for the time being, and I didn't see value anywhere else, so I thought I'd just put it in Synairgen again, because you know what, just go hard or go home, as they call it. Where I am with this company is just, you know, it's gonna go either of two ways with this. I am very confident it's gonna go well, but at the same time, you know, there's a risk to it. £12,000 of my money has been invested in this, and I'm at the start of my journey. If this goes wrong, you know, it's a learning curve, but I really feel it will do well. The science is, you know, it speaks for itself. Take your time, check it out if you'd like to. I'll probably make a video at some point just to talk about this a bit more and why I feel very strongly about this company. So far there's 10,739 shares. Average before was about £1.09. I've just increased my average because the last one I bought is £1.48. It's been going up. Let's just look at it over the last 7 days actually. I'll just switch over here, or let's just go over the past 6 months. I started buying at this point here, end of October, for £1.77. I think I bought £1.80 at some point, and then 6th of November, when the news for the vaccines came out, I think 2 vaccines came out the same week of the 1st of November, it nosedived. Literally on that same day, I remember I was working and then logged into my account, and I saw I was about £4,000, £5,000 down within the space of, I don't know, an hour, which was very alarming, you know, not great to see. But then it kept dropping, went all the way down to 80p, I think. So I consistently, I think I was half of my position in already, about £5,000 when this drop happened, and for me on one end, it's scary, and on the other end, I was just happy because I just felt like this was a really good opportunity to buy more. So I started piling on. I think quite a bunch, and brought my average down from £1.77. No, actually, it was £1.80 average at the start to where it is now. So I just kept buying, buying and buying until now. And this is where we are. It's been going up in the past week, mainly because of the news. So three things really. The first one is the announcement that they've started the phase 3 of the trials for this therapy for COVID. So I think that's about 620 people all over the world. That should last a few months, a couple of months. The second was the OM trial. Oh, where is it? Where's the OM trial? So they've finished recruiting for the OM trial as well. I think it's that one. Yeah. So they are they recruited about 120 patients for phase 2 trial for this treatment. Basically, what it means is, hopefully what they're trying to achieve is prove that you could use this drug without being in the hospital, without having to leave the comfort of your own home. So this is, if it goes well, will be massive in the sense of, for over 65 or, people that are vulnerable, the last thing you want them doing is going into hospital to get treatment, because they might end up catching a bunch of other stuff. So bringing the treatment to them will help patients, and also will help relieve the NHS as well, or other hospitals, because then you won't have to occupy beds. So this fits into the whole theme of telemedicine as well, where you stay in your house, they send you the treatment, and you can do it, get it done, and hopefully get better. So that's the news. And then the latest one, which was today, I believe, was the announcement that it's been added to the active 2 in the US. I can't find that now, but hey, don't worry about it. So what that means is this drug, along with 2 other drugs, I think, have been added to the active 2 in the US, and which means it will be fast tracked as a potential therapeutic for this disease that we all sort of battling at the moment. So that's pretty much it, I think. What I foresee is I expect it to climb higher. I will do an update, hopefully in about a week's time, just to see where it is, just to show where it is as well, whether it's up or down. We'll see. As I said, this either goes really good or it goes terribly wrong. So if it goes wrong, I expect this to tank all the way down to, I don't know, 40, 50p, which will be a tragedy. But you know what? If it goes well, I see this skyrocketing. Sky's the limit, basically. Please do your own research. Don't copy this portfolio. Don't do what I'm doing. Do a lot of research, and if you're comfortable with it, then it's up to you. Anyways, I think